Wrapping up our special series, Pill Nation. This morning, the high price of prescriptions. NBC's Stephanie Gosk is following the money. Stephanie, good morning.
Good morning, Natalie. You know, patients in the U.S. spend more on prescription drugs than any other country in the world. In most cases, it improves their health, keeps them out of the surgery room and out of the hospital. But paying for medicine can be the most expensive out-of-pocket health cost for Americans. Pills, pills, pills. In the next month, nearly half of the population in this country will take some kind of prescription drug.
Next to my mortgage, this is my greatest expense.
Single mom Sherry Thomas has 3 teenagers. 2 of them have been diagnosed with autism and ADD. She says they need their prescriptions to lead normal lives, but worries she can't keep up with the payments.
I'm one of those people that's paying more than I can afford just to get the basic medication that my kids need.
And Sherry is not alone. According to the CDC last year, Americans spent a whopping $45 billion out of pocket on retail prescription drugs. An estimated $4.5 billion was spent on sleeping medications, $7 billion on drugs to treat ADHD, and $11 billion on antidepressants. In some cases, the enormous costs are linked to brand-name drugs. But why are they so high? Pharmaceutical companies say they have to be because new drugs are so expensive to develop and manufacture.
It takes about 10 to 15 years from the laboratory benchtop to a pharmacist's shelf, and it costs on average about $1.2 to $1.5 billion.
Name brands are then protected by patents to both recoup costs and make a profit. The good news in recent years for consumers is that many of the popular name brands have gone off patent.
When a drug comes off patent and a big brand name drug maker no longer has that exclusivity, usually what it means is that the price goes down. The generic person no longer has to do all that kind of marketing, and people will flock to the generic version because the price is cheaper.
Still, Americans struggle, especially those who are uninsured. Over 24% said they did not get prescription drugs due to cost in 2010, versus almost 7% of the insured who say they don't have enough money to pay. Adding to the problem, pharmacist Alan Schnorr says he has seen prices jump in the last year, and now he's getting stuck with a lot of unclaimed prescriptions.
They have 2 prescriptions, and it's $100. That's a lot of money to the working middle class,
right,
or any class.
And experts fear that although unclaimed prescriptions save money in the short term, it leads to higher health costs down the road.
Eventually, it's going to price me out. And then I don't know what I'm going to do. I want my kids to graduate college, yet they need this medicine to help them get there as well.
The CDC released a new study showing other strategies people use to keep their prescription drug costs down, including skipping doses, delaying prescriptions, or turning to alternative medicine, all potentially having an adverse effect on their health. Natalie?
Stephanie Gosk, thank you. Dr. Gail Saltz is a psychiatrist and a Today contributor, and Bertha Coombs, as you saw, covers healthcare for CNBC. Ladies, good morning. Good to have you both here. Now, Gail, let's start with you because we've been talking all week about how overprescribed we are as a nation, people looking for a quick fix. When people are suffering more, it seems, from anxiety and from psychological problems, how do you know when medication is the solution or the right answer for you? When should you seek medical help?
I think if you're feeling overwhelmed, you're feeling like you're having symptoms, you really need to see a mental health professional because these take real evaluations. They have to look at your history. They have to look at all of your symptoms. They have to look at the entire collection of things to determine, do you actually have, say, major depression? And then the question becomes, do you have mild to moderate major depression where medication does no better than placebo? And therefore you shouldn't be receiving medication. Or you have a severe depression, which carries a 15% suicide rate. You should be getting medication. So get a proper evaluation and know that therapy and learning coping skills are every bit as important and sometimes better than medication, which really would lower your cost in the long run.
And Bertha, you have some tips this morning as well on how people can reduce the cost of their prescription drugs. Where do you start?
Well, if it's something that you really need, generics, that's where you're going to get the most cost-effective medication, and it's going to be the same as the brand name. But if you do have to take a brand name, one of the things you should consider is making your prescription longer. Maximize how you get that prescription filled. Rather than every 30 days where you have to have that $5, maybe $10 copay, then do it 90 days, get a 90-day prescription, and you're only paying one copay there, so that
Right.
reduces your cost. Also shop around. The different pharmacies have different pricing strategies. In some cases, you might want to do mail order through your insurer, and also maybe try to get some sort of lower price as a result of that because it's automatic.
Right.
And the other thing to do as well is to look at your plans. Different plans sometimes cover different types of drugs. If you're married, look and see whether your spouse's plan has better coverage than yours. And finally, the thing to do as well to stretch your money is to do one of these pre-tax accounts, a flexible savings account if you get it from your employer, or if you buy it yourself, you can also do a health savings account if you have a high deductible. If you're in a 15% tax bracket, for example, and you're
Right.
paying $100 a month, you're getting the full $100 worth rather than taking it after tax, and you have to make up that extra 15%.
So good to put money in those accounts.
Exactly.
All right, Bertha Coombs and Dr. Gail Saltz. Ladies, thanks for great information as always.